Hello everyone, welcome back to my YouTube channel. Today we are going to talk about posterior triangle of neck. As in last video we talked about anterior triangle of neck. In this video we will talk about posterior triangle of neck. We will start our topic with introduction. Posterior triangle of neck is an important anatomical region that is located behind the sternocleidomastoid muscle and it contains vital neuromuscular and muscular structure. It serves as a crucial landmark for clinical examinations, surgical intervention, and injury assessments. Now let's talk about boundaries of posterior triangle. Posterior triangle is defined by three anatomical boundaries. First is an anterior boundary that is by the posterior border of sternocleidomastoid muscle. Second is posterior boundary that is by anterior border of trapezius muscle, and the third is inferior boundary that is by the middle third of the clavicle. The posterior triangle is further subdivided into two smaller compartments, each housing different key structures. So its subdivision include occipital triangle and supraclavicular triangle or subclavine triangle. So first is occipital triangle, that is the subdivision of posterior triangle. It occupies the upper portion of posterior triangle. It contains spinal excessive nerve, that is cranial nerve number 11, which supplies the sternocleidomastoid muscle and trapezius muscles. It serves as an important reference for nerve function and muscle coordination in upper neck. Second subdivision is supraclavicular triangle or subclavine triangle. It is located in the lower region of posterior triangle near the clavicle. It contains major vascular structures including the subclavian arteries, subclavian vein, and branches of brachial plexus. It is significant for vascular assessment and medical intervention involving the upper limb circulation. Now let's talk about clinical significance of posterior triangle of neck. The first significance is surgical and diagnostic application. As supraclavicular triangle is critical in vascular surgery such as procedure involving the subclavian artery or vein. The second is the occipital triangle is examined for spinal excessive nerve injuries which can affect shoulder movement and trapezius function. The posterior triangle serves as an anatomical landmark for brachial plexus nerve blocks that are used in pain management. Second clinical significance is trauma and injury consideration. As neck wound penetrating the posterior triangle can damage the brachial plexus leading to sensory or motor deficits in the upper limb, and blunt force trauma to the occipital triangle may compromise the spinal excessive nerve causing shoulder drooping or weakness. And the deep neck infection in this region may extend into surrounding structure affecting circulation and nerve function. Next clinical significance is a landmark for physical examination. As physicians palpate the supraclavicular triangle to assess vascular abnormalities or lymph node enlargement. The posterior triangle is inspected for nausea, neurological deficits, or signs of muscle atrophy. Now let's talk about functional importance of posterior triangle. It has role in neurological and vascular function as the posterior triangle houses important arteries, veins, and nerves that ensure proper circulation to the head, neck, and upper limb. It provides a pathway for nerve transmission including signals from the brachial plexus to the arms. Next functional importance is its contribution to the musculoskeletal movements. As the spinal excessive nerve with the occipital triangle enables head and shoulder mobility. The trapezius and sternocleidomastoid muscles enclosed by the posterior triangle contribute to the postural stability and dynamic movements. Now let's talk about the conclusion of all of this lecture video. Posterior triangle of neck is vital for neurovascular function, musculoskeletal coordination, and clinical assessments. It serves as a key anatomical reference in surgical procedure, trauma evaluation, and physical examination. And this was all about posterior triangle of neck. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.